Greetings from warm Geneva to everyone. WHO press briefing on COVID-19 and other health issues. As we have put in our media advisory, we have a special privilege today to host members of WHO who will present to you that is focusing on accelerating access to genomics for global health. Dr. Tedros, in his opening remarks, will introduce the chair, who will say more about that, and we hope that we will be getting questions on that topic as well. Before giving floor to Dr. Tedros, let me just, with us here in the room, we have our chief scientist, Dr. Dr. Mike Ryan, our executive director for health emergencies. And online, we have Dr. Rosamund Lewis, technical lead on monks. And we also have Dr. Bruce Aylward, advisor to Director General, and who leads on. We may be joined by other. Well, so just before on WHO Science Council and their report, please, beside raising hand, drop a quick word in a Q&A so we can prioritize you, as the chair will have to leave us soon. So with this, I'll give the floor to Dr.
Thank you, Tariq. Good morning, good afternoon, and good evening. I'm concerned that cases of COVID-19 continue to rise, put pressure on stretched health systems and health workers about the increasing trend of deaths. The Emergency Committee on COVID-19 met on Friday last week and concluded that the virus is a public health emergency of international concern. The committee noted their concern about challenges. First, and BA.5 continue to drive waves of cases, hospitalization, and death around the world. Second, surveillance has reduced significantly, including testing and sequencing, making it increasing the impact of variants on transmission and the effectiveness of countermeasures. Treatments and vaccines are not being deployed effectively. The virus is running freely, and countries are not effectively managing this burden based on their capacity in terms of hospitalization for acute cases and the expanding COVID-19 condition, often referred to as long COVID. Finally, there is a major disconnect in COVID-19 between scientific communities, political leaders, and the general public. This is risk and building community trust in health tools and public health social measures like masking, distancing, and ventilation. The committee made a series of recommendations with to focus on. New ways to demonstrate again that the COVID-19, as the virus pushes, we're in a much better position than at the beginning of the pandemic. Of course, we have made good progress. We have safe and effective that prevent infections, hospitalizations, and we should not take them for granted. Finance ministers meet next week. It's critical that governments around the world finance WHO and the ACT Accelerator to ensure the distribution of health tools. As transmission rise, governments must also and tested measures like masking, improved protocols. I urge governments to regularly review and adjust their COVID-19 response plans based on the current epidemic, also the potential for new variants to appear. Governments should also work to reverse the reduction sequencing and share. Vaccines have said it's important for governments to focus on finding the unvaccinated so as to build up the wall of immunity toward the 70% vaccination target. And tackling COVID-19 should also go hand in hand with vaccinating for killer diseases like measles, pneumonia. It's a question of either or. It's possible to do both. And new vaccines, including HPV and malaria, should continue. Today, WHO released vaccines in development to prevent infection, bacterial pathogens. Examine some of the challenges faced to nurture innovation in a space that has been severely neglected. I'm glad to be joined today by WHO Science Council, which I set up just over a year ago to provide science and technology that impact global health. Led by Dr. Harold Varmus, the group just had the first in-person meeting, been focused on genomics given its implications, the challenges of scaling it up in low and middle. During COVID-19, genomics has been essential to detecting the virus initially and new variants subsequently, and also integral to the development of tests, treatments, and vaccines. As new 10-year global genomic surveillance covers disease detection, tests, data sharing, and analysis, so that together new health tools can be developed and deployed. Genomics has massive potential beyond pathogen and health. It's timely and human resources in this area. To tell us more about the work of the Science Council, I'm happy to hand over to Dr. Harold. Dr. Varmus, you have the floor.
Thank you, Dr. Tedros, and we appreciate your invitation to ask this capacity, and we're very proud to be on the expansion of a small group, but we've been guided by the scientific community. 3 workshops held in the fall that assembled hundreds of people in genomics and who are interested in our application. We recognize a variety of influence and the benefits of many other fields beyond health in the COVID pandemic, namely in the development of vaccines and tests and the identification of variants that continue to pose serious problems for the wider public. We, as a small group, have assembled to the WHO, to member states, to organizations and academic institutions, and they fall into 4 thematic areas. And I'm going to review them extremely briefly to save time for questions. Argue that WHO and member states adoption of the use of genomics, and that the WHO should assemble a genomics committee that oversees and assists with the implementation of genomics. The second broad implementation, we're encouraged by in the workshops that genomics has been adopted in many relatively poor countries. Costs are coming down. There are incentives to encourage that commercial providers of the ingredients, machines, reagents, software, incentives of the use. That the already widespread use of genomics in in advanced countries should not leave lower and middle income behind, as has occurred in many other contexts. The issue is collaboration. We've seen evidence already in scientific disciplines between countries, and we encourage in many aspects of our recommendations the usefulness of collaborating among scientific groups and among nations. And recommendations to have been associated for several years. WHO become the authoritative source for mediation and guidance about these issues. We are optimistic about future applications of genomics. We believe and the economic and scientific adoption of widespread use is feasible, and with the encouragement of WHO and its leaders can be achieved. I look forward to questions accompanied by several of my colleagues from the for the first time in person, and the attention that the nations can give to the release of our.
Thank you, Dr. Council and Genomics, and for the recommendations. I couldn't agree more about the importance of scaling up genomic sequencing capacity globally, and also ensuring that enough bioanalysis are to act on the sequencing. On monkeypox, there are now 9,200 cases in 63 countries. The Emergency Committee for Monkeypox will reconvene next week at trends, how effective the countermeasures are, make recommendations for what can do to tackle the outbreak. In the meantime, the multi-pronged approach continues. First, WHO is working with civil society and LGBTIQ, especially to tackle the stigma around the virus, so people can stay safe. Second, WHO continues to work with countries and vaccine manufacturers to the sharing of vaccines which are currently. WHO continues to work with countries to drive forward research and development. On Sunday and Monday, the National Institute for Biomedical Research in the Democratic Republic of Congo, the National Institute of Health and Medical Research of Allergy and Infectious Diseases, trained researchers and experts in trials worldwide to develop consensus on a global core protocol for the evaluation of monkeypox. I again stress that onward transmission and advise governments to help track and stem the virus, as well as to assist people in isolation. In Ghana, there are currently detected cases of Marburg. Ghana is currently to the Institute Pasteur of Dakar in. In the meantime, the Ministry of Health has set up precautionary contact tracing, case investigations, and preparedness in health facilities support of WHO. Finally, on Syria, the United Nations Security Council resolution on cross-border operations in northwest Syria is very good news for the nearly 4.5 million whose lives and health depend on this access. WHO and partners will continue and healthcare to this vulnerable population, 80% of whom are women and children. We thank the security for protecting and ensuring this vital operation and avoiding an almost complete aid. Tariq, back to you.
Many thanks, Dr. Tedros and Dr. Varmus for these opening remarks. We have shared with the report and accompanying press release on Council, and as Dr. Varmus has said, we'll be happy to speak to media anytime it's needed. Now we will open the floor to questions. We will go first to Erin Prater from Forbes. Erin? Fortune, sorry. Erin is from...
Yes, thank you so much. Just curious about the COVID-19 subvariant BA.4.75. Curious about tracking, what kind of levels have you all seen, and what are the implications about the implications of the mutations? Thank you.
So thanks very much for the question. So BA.2.75 is one of the sublineages of Omicron that we are tracking. As you know, several sublineages, dozens and dozens of them, in fact, that we are looking at a global level. All of the sublineages of Omicron rise as a variant of concern. I just want to stress that. To track and trace variants around the world depends on surveillance. It depends on the surveillance for the SARS-CoV-2 virus, the testing that is taking place, the sequences that are conducted and are shared so that scientists in the world can assess those. In particular, for BA.2.7 available so far of this one, less than 200 sequences or around 200 sequences are available from about 14 countries. Many of these sequences have been shared from India, reported from India, and the first collection date of the around May 2022. Our understanding so far because we have a few sequences that are available. I just want to take the time to stress, given the topic of SARS-CoV, the Science Council and what they've been discussing, what we have been talking about over years now, the real importance of surveillance, of sequencing, and the analysis of those sequences. Our ability as WHO at a global level to assess these is reducing. And the reason for that is because surveillance has reduced for SARS-CoV-2. So it's really important that surveillance activities and, in fact, enhance them, strengthen SARS-CoV-2 surveillance with other respiratory pathogens that are circulating so that we could track the known variants as well as to be able to detect new ones. As more information becomes available of BA.2.75, we will, but per usual, what we look for is characteristics of severe or less severe. Whether or not our interventions continue to work. Our interventions continue to work against all of the sublineages of Omicron. It is that not only surveillance continues, but we continue with vaccination. Are incredibly protective against severe disease. Vaccines are safe and effective and prevent receives those vaccines around the world, and we particularly prioritize those who are most at risk of developing severe disease, those who are over 60, those with underlying conditions, and those who are more at risk for infection, for example, our health in every country around the world.
Thank you, Dr. Van Kerkhove. Next question. Denise, can you unmute yourself, please?
Oh, hello. Hi.
Yes, please go ahead.
Thank you. About the distribution of money. So I understand that although the Danish vaccine, there is a good supply of ready-made bulk vaccine, most of which is owned by the US, that could be filled and finished at contract manufacturers. Just to note some of the specifics, I suppose, of the act the WHO is calling for to make that vaccine available, asking the US to share this bulk vaccine, taking any steps to speed up the fill and finish process.
should be online and hopefully with a video connection. Dr. Lewis.
Yes, thanks very much, and thanks for the question. So yes, WHO is working with countries who have with manufacturers who produce vaccine capacity, and also working to study protocols, different users of vaccines to monitor the vaccine effectiveness and safety, of course, in the field for during this particular.
Thank you, Dr. Lewis. We will move to the next question. Rigby from Reuters. Jennifer?
Hello, thank you for taking the question. It was two quick ones, actually, one on the genomics report and BA.5. I'll keep them short, though. BA.5 seems to be causing alarm in various countries, particularly the US, and I just wondered from a is there anything kind of scientifically more concerning about this variant? About reinfection. So just asking for a kind of scientific perspective on that. And then also on the genomics side of things, I saw in the report that gone up from I think 54% of countries to 68%. And I just wondered if there's any concern that that might slide back post pushing for this now. Thanks.
Thank you. Let's start with the first part of the question, Dr. Van Kerkhove.
Yeah, thanks. So BA.5 is one of the sublineages that we are tracking of Omicron. It is of concern for us. The continued virus evolution of SARS. As I said before, the more the virus circulates, the more opportunities it has to change, and that fact has not changed. The virus is spreading at an very intense level at a global level, and again, our ability to detect cases is reducing. Strategies have changed. So BA.5 is one of the sub in terms of the 5 that have been reported and are being tracked by scientists around the world. Our technical advisory group for virus evolution, which has been meeting regularly throughout this pandemic, assessing BA.5 as well as all of the other sublineages. 5 has a growth advantage over other Omicron that are circulating. And when we look at the ability of this virus to which we are seeing with BA.5. We are seeing countries become concerned about this, but we feel countries should be concerned about SARS-CoV-2, whatever circulating globally. And we also not only need to disease and death, which is absolutely critical, and we can do that, we have to take measures to reduce the spread. You specifically asked about the risk of reinfection. We don't have as many specifics as I would like to be able to report on reinfection, but we are hearing of reports of reinfection. I'm sure totally know of people who have been infected with Omicron. That is that people are infected with 5, BA.2 of the reports, and has increased substantially over the last 4 weeks alone. We expect that trend to continue around the world, but we will continue this as we go forward. We need more data to be able to do that transmissibility, immune escape, severity. I should say, we have not seen an increase in severity over other from the preliminary data that we have with WHO and with others around the world. And we know that our diagnostics continue to work, our vaccines continue to work to prevent severe disease and death.
Thank you, Dr. Van Kerkhove. And maybe we can address the question Jen had on genomics. Had to leave us, but we have with us Sally, Center for the AIDS Program of Research. Try to.
Much for that question. Oops. That question. As we've looked at the capacity for
countries to undertake research in systematically an expansion driven initially by diseases like HIV, but now COVID-19 has also led to an expansion of capacity. What's important in genomics, once you develop the generic capabilities, very widespread application. So they have application of COVID-19 to surveillance for different variants. But it could just as easily and a variety of other conditions. So we anticipate that genomics, instead of returning to pre-COVID-19 capacity, we'll see going to expand and its use also continue.
Is clarification. We have Ari Daniel from NPR. Ari, the floor is yours.
Thank you so much. Yes, I was wondering about the upcoming committee that's being convened on monkeypox. You mentioned a little bit about that. I was wondering if, what and whether this convening is happening sooner or later than was anticipated at the last gathering of the emergency committee. Thanks.
Thank you, Ari. We are also Dr. Sylvie Briand, who is the Director of Epidemics and Prevention Department here at WHO. So maybe Dr. Briand can try to answer this question. Dr. Briand.
Thank you very much. Indeed, when the committee met, they assessed the case, but since then the situation has see an increase in affected. Based on this new information, it's worth looking at it again and see if we need to reinforce certain advice or also revisit the strategy. So basically, we'll look, they provide criteria that need at those criteria. Basically, the increase in number of cases, the deaths, if there are any deaths, if the disease is spreading outside the initial affected community, if we see changes in the virus, and so on. Those criteria with the emergency committee and see if we need to then modify the strategy or declare a public health emergency of international concern at this stage. Thank you.
Thank you very much. Let's go to the next question. Laurent Sierro from Swiss News. Laurent?
Yeah, thank you, Tarek, for taking my question on monkeypox. There is a study, I think there was a study. There might be some transmission. Have you?
Dr. Ryan? Dr. Lewis, maybe first.
Thanks very much. I'm not sure to which study you may be referring. The possibility of transmission food has always been a situation when there is exposure through, infection through exposure to an infected animal, which is how monkeypox originally was described. So it was described as a zoonotic disease where the virus circulates in certain rodent and also primate things in West and Central Africa and in forest hunting, and they may bring out game in cooking, not completely cooked food are all different ways of possibly being exposed if consuming, if hunting and preparing wild game that may have this virus. Of course, that setting in West and Central Africa, we don't have food in the current multi-country outbreak in other parts of the world.
And just to emphasize what Rosamond has said, that the association with food is the food animal that may have the disease passing it on to the human right now. That normal consumption of normal food chains, going to the supermarket, buying your food, is in any way associated with any risk of getting monkeypox. That is very. But it's also important that we look at all possible routes of transmission. Increasingly, that suggests, and this was known before, that fomites, or contamination of surfaces, particularly in a healthcare environment, could be associated with onward transmission. At least virus can be cultured off those surfaces, which was rather difficult to do in COVID. So clearly, the prevention and control in a clinical setting is very, very important, and also in the setting, household setting, where there is a case in terms of isolation and avoiding of most of this transmission that has occurred in monkeypox historically between people with very close, prolonged personal contact. Prolonged and close sexual contact has been the main driver of transmission. That's what's driving the transmission in this outbreak. We will continue to explore and be very clear that all routes of transmission will continue to be investigated. We thank scientists who are looking at transmission, but we also need to be and ensure that people don't associate study the actual transmission routes or the things that are driving transmission. So your food is safe. Always it's important to follow the instructions with food, and food poisoning is a constant risk, and therefore the proper handling is very, very important. And within that context,
thank you, Dr. Ryan and Dr. Lewis. I think we have a time for one more question, and we will go to Ashwin from Observer Times, India. Ashwin, if
thank you. My question is, how national animal disease control centers are essential in the countries to control monkeypox disease and other zoonotic disease research programs? Action taken by WHO for capacity building animal disease control centers. Thank you.
Thank you very much, Ashwin. Interesting question on animal disease control centers. Maybe Dr. Van Kerkhove?
Yeah, I could start and others can come in. I think a really critical aspect of studying health approach, which is not a new concept. This comprehensive approach to understanding how we as humans live with animals and live in the environments that we share with animals is really important to understanding not only food and trading and raising of animals, but also of these emerging pathogens from into animals. With the Food and Agriculture Organization of the United Nations, and also OIE, which now has a new acronym, and with many around the world in the vet sector, in the animal sector, in the environmental health as well, to improve animals, in domesticated animals and wildlife along those trade routes, among people who are working and caring for these animals, raising them, selling them, and in human populations around the world. There are pathogens that are zoonotic, that have epidemic and pandemic potential on across the world, so that we have better detection capacities, which includes surveillance in communities and on farms. It includes improving lab detection capacities around the world, improving not only vet labs around the world and in partnership from animals and humans go to the right labs, have the right types of laboratory assays to detect the known pathogens as well as look for new ones. And it also links to sequencing. One of the earlier questions around sequencing and building that capacity, so much effort around the world has improved sequencing capacities around the world, and there is the threat that that will decline over time, and which is why it is such a major focus for WHO and our partner agencies. Launched a 10-year strategy to improve genomic sequencing for pathogens with epidemic and pandemic to enhance that detection and assessment capabilities in animals and in humans. So for us, it's a partnership. We work with ministries of health, we work with ministries of agriculture, ministries of the environment across the different sectors so that we have a much more holistic One Health approach to understand. But our work continues. So any time that we detect a pathogen or a new pathogen, or we have an outbreak or prevent an outbreak from happening, our work doesn't stop. Something that is a constant and needs constant investment, constant. So thank you very much for that question. I think it's important in the animal sector that they in place, that they have the workforce. There are many incredible village vet workers that are in countries that are looking for in animal mortality, for example, and have those triggers. Unusual. Let me trigger some action. Indeed, that's unusual. But for us, it's about our partnership with that animal sector.
And just to add, the relationship, the partnership between the four agencies, the FAO, OIE, and the United Nations, it's been expanded recently to include UNEP. So there's a huge amount of work planned and underway by the four organisations as part of a One Health initiative in-house. But also over the years we've been working very closely, and the question is doing to work with those agencies. You've probably heard ad nauseum here for the last 2.5 years. We speak about the IHR and the Emergency Committee. Under the IHR, that is what the legal obligations of countries under the policy. There's another system that OIE, the Office for Animal Health, have called the Performance of Veterinary for strengthening capacities in veterinary systems. We have been working with OIE and FAO and running what we call bridging workshops all over the world in all 6 regions, in which we have multi-day workshops with the veterinary teams and the public health teams to work on exactly these issues. How do we work together? Because that's the practical issue. We can talk about the importance of the issue, we can talk about the science needed and surveillance needed, but unless these two critical services and national work together from the ground up with communities and all, then we won't make progress. So, as Maria has so well Joe is fiercely committed to, as are our partner agencies in this regard.
Thank you, Dr. Ryan. Thank you, Dr. Van Kerkhove, for answering this question from Observer Time. We will conclude today's press conference. We will send you audio and video material, and then we look forward to seeing you next time. Dr. Tedros had to leave us, so I will wish you a very nice next time for WHO regular press brief.